Hi, welcome to Extending Healthspan, my website. I'm Judy Gustafson, and I'm a physician, board certified in internal medicine, anesthesia, and most recently obesity medicine. And I teach at Virginia Tech. I teach Extending Healthspan, and I also teach advanced anatomy and physiology. What I want to do is just introduce the website to you, some of the factors that we've learned, and first of all, I'll share my screen and we'll jump right in. So an overview of what wellness is. I'm gonna just show you the difference between disease span, health span, how health span can be actually measured now using telomeres, and we'll talk about what that is, and about weight watching and learning that it's actually not the BMI, but it's your belly. And then talking about weight loss, and then actually using dementia prevention program as a strategy to lose your belly fat. So you take two people. This is Wilfred Brimley at age 50 years when he played in the movie Cocoon. And this is Tom Cruise at age 56 playing in Mission Impossible. And you can see there's a dramatic difference in the appearance of their age. Wilford has a shortened health span as compared to Tom Cruise. They may both live the same length. Actually, Wilford Brimley just died at 85, but he was also plagued with diabetes, heart disease, some other things. So he had a longer disease span versus Tom Cruise, who's looking younger and more likely to have this lengthened health span. So why do some people seem to age so fast where others do not? And this is all comes down to cellular aging. It comes all the way down to the aging process. And that's what defines within the cells telomeres. So after many, many cell divisions, your telomeres, which are at the ends of your chromosomes, these little blue things, they get shorter and shorter. They're described as the tips of shoestrings, the little plastic tips. Actually, as originally described by Elizabeth Blackburn, who wrote The Telomere Effect, was the Nobel Prize winner for 2007 on discovering telomeres and telomerase. And what they found is that with cellular aging, though your chromosomes start losing the tips, the telomere tips, and without that protection, your cells start to lose their flexibility, the youthfulness, and then it shows on the skin, the hair, the grain, and then that's when diseases and aging begin. So the question, could you explain body weight alone for the dramatic difference in telomere length and the aging process? So looking more closely, looking at body weight, waist circumference, epigenetic changes, and telomere shortening. If you just look at BMI, BMI is actually a public health nomenclature to describe large populations. It only uses weight divided by height. It only has these two measurements. The flaws with using BMI is it doesn't take into account the body composition. So the guy on the left, you got this big bodybuilder, lots of muscle mass, weighs the same and is the same height as someone who has more central obesity. So BMI, there's a lot of flaws to using BMI. So telomeres, how do they look at body fat? And there were a lot of studies. Actually, this is a meta-analysis, taking many, many studies, similar types of studies, and looking at the results. And of all those studies, 39 of the studies showed only weak or only moderate correlation with being overweight or obese and telomerase or telomere length. The authors concluded that it is actually the belly, not the BMI, that you should be concerned with. The BMI also, it misses not only body composition, but it misses gender. So we see a lot of eating disorders in women because they're so concerned about losing fat. Whereas this, you can see in the orange, is essential fat. I like to call it the baby maker fat. It's essential for carrying pregnancy. So too high of belly fat decreases fertility. Too low a belly fat is the same thing, and you can't get pregnant. So it is the belly fat or visceral fat that causes all the problems with inflammatory diseases, which include cardiovascular diseases, causes insulin resistance, developing into type 2 diabetes. And it's the visceral fat that's metabolically active, causing those diseases. Visceral fat shown here in a sagittal view, looking at the body, and it's not the subcutaneous fat that causes the problem, it's the visceral fat. The fat around the organs. By being metabolically active, it means that these cells actually send out these inflammatory signals. And if you want to know the pathophysiology, in case you want to know, I'll tell you in just the next slide. The other problem that happens with aging is we lose this enzyme, this fat storing enzyme called lipoprotein lipase. Actually, it's stimulated, excuse me. It's a fat storing enzyme, and it's now unopposed with decreasing estrogen and progesterone, testosterone. And you see this more central obesity with aging. So here's a pathophysiology slide I wanted to show you. In normal adipose tissue, it's got good blood supply, not too much, and then as it grows, get bigger fat cells or more numerous fat cells, it outgrows its blood supply, and some of those cells die. These cleaner cells called macrophages come in, and during that process, they release these inflammatory cytokines. So it's all from oxidative stress causing inflammation, and then causing these disorders, including cardiovascular disease, diabetes, and cancer. So stressing about weight loss, the facts, a lot of studies with this, it's actually stress increases the visceral fat. So in all the studies, stress actually is more strongly linked to telomere shortening than BMI. So this is a study looking at chronic stress, impulsive risk-taking predicts increases in visceral fat. So stress, a very circuitous arrangement, cyclic. Stress, weight gain, visceral fat. So it's felt that rather than focusing on weight loss, we should be looking at the things in our lives, the epigenetic changes that can modify our telomere lengths. So I threw this word out, epigenetics. DNA, of course, we can't change our DNA, but we can change the expression of the gene coding on our DNA. And that's the new realm of epigenetics. So we can keep some of these badness genes hidden away, locked up with the right lifestyle interventions. An example of one that got loose, the KLF14 gene, with exposure to environmental changes, you can expose that gene and increase the risk of having an increased BMI. So there's a lot of external forces on our genes and our telomeres. So the external forces I'm showing here, of course, are inactivity, showing as a couch potato. Then, of course, toxins, the toxins that we eat, toxins in the air, smoking, that kind of thing. Late night eating is a big one. And that's what we talk about. Intermittent fasting is very effective for reducing, for late night eating, reducing telomere length and affecting our epigenetics. Of course, there's stress, big deal. The ultra processed foods, talk about fast foods. And of course, my biggest bugaboo is that sleep deprivation. Gets much, much more difficult with aging to get that really high quality sleep. So speaking of aging, looking for a great weight loss program, I would recommend trying the Dementia Prevention program. And I want to show you this great little study I came across almost 8 years ago. It was considered a pilot study at that time before it became huge, a great big study. But the original study that I saw was taking only 10 people with documented dementia or Alzheimer's disease. And they were using a multimodal treatment approach where they are doing aggressive lifestyle interventions. The results of that small study showed that 9 out of 10 had complete reversal of their dementia. And as a side effect, everybody in the study all lost excessive body fat as an unintended consequence. I want to just talk about this example, this woman that was in the study that been following her for over these 8 years. She's 67. She's a data analyst, and she was becoming more forgetful. And when she started to forget, just 4-digit numbers, she was diagnosed as developing progressive dementia. And her mother had just died from a long bout of Alzheimer's disease. And she really did not want to die that way. So she decided that she would commit suicide. And prior to doing that, her best friend talked her into joining the study with Dr. Brady. The intervention program that was built specifically for her was a diet that eliminated all her simple carbs, including gluten, processed foods. She increased her sleep from 4.5 or 4 to 5 hours per night to 8. She went on to an intermittent fasting program, so 12 hours between dinner and breakfast, and nothing to eat, no calories, 3 hours before bedtime. She started a stress reduction program, including yoga and meditation. And she had supplements that included vitamin D, B12, fish oil, and CoQ10. And her exercise was 30 minutes a day of only moderate, not intense, 4 to 6 days a week. And she also became a yoga instructor. So the results back then, within weeks, she had a reversal of dementia. She went back to work and she had a 20-pound weight loss. So 6 years later, actually now 7, coming 8, she still chooses to work and she continues with the same lifestyle plan. So the results of this study was that wellness is achieved through the lifestyle changes. And what happens following that is the perfect weight follows. So that was the initial study in 2014. And since then, Dr. Brady has incorporated over 3,000 participants with multiple centers. He's written this book, published a book that I included actually in one of my library books in the website. And he's not the only one that's recognized that lifestyle interventions have an effect upon mental soundness or cognition. So this FINGER study, it's an acronym for this Finnish intervention study. It's a a huge study. It's randomized controlled trials to tease out all the factors that affect dementia. And through that, 10 other countries have also initiated studies with all different acronyms, besides FINGER, MIND, AD, SINGER, all of these countries from China to India. So the rationale behind each of these interventions, I'll go through that briefly, and then in the subsequent lectures or upload videos, talk about each individual intervention more in detail. So the diet, the whole point is to reduce that systemic inflammation, showing the elevated blood glucose increases the inflammatory cytokines, and then changing that blood glucose helps to prevent insulin resistance and reduces inflammation, not only in the brain, but also throughout the body. The other is the stress reduction. Stress has a direct impact on the adrenal glands, and increasing cortisol comes from the stimulation of the adrenal glands. That also affects appetite. It decreases the metabolism, resulting in weight gain. Sleep. Sleep is vitally important. One of the discoveries of Alzheimer's was this deposition of beta amyloid plaques along with tau, but it's only during this very deep period of sleep that you start to use this system in your brain. It's only in your brain. It's called the glymphatic system, and it and a period of time during the very deep parts of sleep that the brain cells shrink and the cerebral spinal fluid flows between the brain cells, and it removes that metabolic waste. And then fasting, that's the beginning of what they call autophagy. When old dead cells are recognized, it becomes a process of actually self-eating. So autophagy means self-eating, phage means eating. So you can clear out the old cells and regenerate new, fresh cells. And then the supplements, these are all individually based, and these are all personal, through personal testing, blood testing. So to see if people's vitamin D levels are low, that sort of thing. So those are the replacement of all those nutritional deficiencies. And along with aging comes melatonin that initiates sleep. And with aging, it starts to decrease the release of melatonin by the pineal gland, or you can call it pineal. I like pineal. Okay, so exercise, another right in there with sleep. Exercise reduces inflammation by releasing these anti-inflammatory cytokines called myokines from muscle. They help to reduce the appetite, reduces inflammation, hugely effective. And it has to be done moderate. It can't be done super intense or you get too much breakdown. Super intensity in the exercise actually stimulates appetite. So in summary, we talked about it's the belly, not the BMI. Stressing about weight and stress about weight loss are counterproductive. Epigenetics, and of course, telomere shortening. And then along with that are the wellness factors that affect the improvement of telomere lengths and also epigenetic expression. So the disease risk increases with your greater waist circumference through this process of visceral obesity, cell death, and inflammation. So our whole goal is to reduce inflammation, which in turn keeps your telomeres long and reduces the diseases of aging. So we have visceral obesity as one example, but all these other lifestyle factors can influence telomere shortening. So the 6 factors again that hurt telomeres and have effects on the epigenetic codes of the DNA. Talked about the toxins, inactivity, sleep deprivation, unprocessed foods or ultra processed foods, and stress. So to reduce inflammation, all the things, quality sleep, 8 hours, exercise, unprocessed foods, meditation, stress reduction programs, intermittent fasting, and also replacement of supplements if those are lacking in your body. So I'm going to leave it with, you don't have to be old to reap the benefits of these 6 lifestyle interventions. And one of the people that I love to talk about is Tom Brady, very successful. And his meals, lots of green leafy vegetables, lots of plants. He does an intermittent circadian 12-hour fast. He sleeps with special mattress, special pajamas, $200. I say 200, that's actually $200 pajamas. Has a bedtime ritual. He makes sure that lights are out at 8:30 at night. So the videos that are coming up are going to include the circadian rhythm. We talked about circadian fast. So that's your biologic clocks. Going to talk about intermittent fasting, how it works, how to get started, the different types of foods, some of the studies, the effects of stress, sleep, exercise, and I'll go through some of the supplements and some of the supplements that I use. So wellness, a balance of forces influencing the self. And that is the end of my slideshow, and I look forward to seeing you back. Thanks.